So who may be a candidate for an immediate implant?
The bone around the tooth has to be healthy. So normally the immediate implant candidate is somebody who's eating lunch and breaks a tooth. So it's not a cavity that got abscessed, it's not gum disease where there's a lot of bone loss and unhealthy gum tissue. It's someone had trauma and the tooth broke off and there's no way of saving it. So those are the ideal candidates because the bone around the root of the tooth is perfectly healthy. So we just tease the root out, place the implant in gently, and the whole process takes probably less than 20 minutes, and then they go home and eat ice cream for the day.
Oh,
so it's not
that's a bummer.
bad. I know. It's too bad.
So then what would prevent a patient from being a candidate for that immediate implant?
There's a couple things. One would be their health history. There are a few patients out there who are taking certain medications who prevent us from doing any kind of oral surgery in their mouth, and those would be the osteoporosis, osteopenia medications. So we have to be very careful on that patient population who's exposed to those medicines. There's ways around it, but it gets a little complicated. And then people who have chronic gum disease, chronic bone loss, a lot of inflammation, they just may not have enough bony support for an implant. And so we just have to pick our patients carefully.